Hello, my name is Gabriel, and this is my mini 3 to 5 minute presentation on bleeding control. Bleeding is a very important topic because it is the #1 preventable cause of death. When discussing bleeding, we break bleeding up into 2 categories, controlled and uncontrolled. We will be focusing on uncontrolled bleeding. Uncontrolled bleeding is defined as spurting atrial blood, pooling of blood below the patient, closed soak through, a partial or full amputation, and any patient who has bleeding that is becoming confused and or unconscious. The first thing we want to do is find the bleed. Whether that is cutting clothes, lifting clothes, removing clothes, find the bleed, find exactly where it's coming out of. Then you want to categorize it as controlled or uncontrolled. Simultaneously, you want to start with direct pressure. How we do direct pressure is using force and or weight, hands, elbows, and knees. So if I were to have someone who's bleeding on their thigh, I could use my hand with a lot of force, put my knee and put my weight onto the injury, or in a shoulder, use your elbow and place weight onto the injured site. Secondly, we want direct pressure with gauze. Using gauze to place directly onto a bleed or injury and hold it firmly. While holding that pressure, you want to wrap the injury. And place direct pressure on. If this controls the bleed, that's great. If the bleed is not controlled and you continue to bleed, we need to move on to further, more aggressive steps, which is a tourniquet. You would always keep the gauze on the patient, but for this demonstration, we have to take it off. Tourniquets. Tourniquets are good for extremities, uppers and lowers. They are not to be used on the elbows or knees. How you'd use the tourniquet is you would slide it through whatever extremity you need to put it on, slide it and tighten it with the Velcro strap. Then you would use the windlass and you would tighten it down up to including 3 turns of the windlass. You would use the support to hold it in place and then tag it over and mark the time. So how do we know that we have a correct tourniquet application? We would have negative distal pulses, bleeding would stop, and we would hopefully have discolorment of the skin below the extremity, meaning blood was not getting into the capillaries and giving us that pink color. When dealing with tourniquets, pain is not necessarily a bad thing. It doesn't mean that it was put on improperly. It means that if you have the steps of negative distal pulses, bleeding stops, and discolorment, it is on correct. We can treat pain later. Tourniquet applications in the state are good for 2 to 4 hours. No one has ever lost an extremity due to tourniquet application below 4 hours. Thank you for watching this presentation. If you would like more information on that, there is a great website called Stop the Bleed. Thank you for watching.